So, healthcare premiums are suddenly going up right when the government shuts down? Coincidence? Or are we watching another fear tactic unfold right in front of us? Because every time there's a shutdown, we start hearing the same message. If the government does not reopen, your healthcare could be at risk. But what if that's the point? I want to break down why rising health costs during a shutdown might not be an accident at all, but a strategic move that actually benefits this administration. When the government shuts down, thousands of workers are sent home. Departments like Health and Human Services, the same one that regulates the Affordable Care Act, go into partial shutdown. That means fewer people are getting approved, insurance rates, fewer people reviewing subsidies, and fewer people communicating with the insurance company. So what do insurance companies do? They panic. They raise the rates because when the government isn't functioning, they don't know if they'll get paid on time. And suddenly the premiums, they go up. Not because of the system is broke, but because the fear of uncertainty makes it easy to justify. Here's where it gets interesting. When people see those premium hikes, they don't blame insurance company. They blame the shutdown. That fear turns into a powerful tool. You see, it creates pressure. It shifts the public's opinion and it lets the administration say, see, this is why we need to pass our biggest budget plan to protect your health care. You see, that's where fear becomes leverage, and the timing is perfect. Healthcare anxiety hits hardest among the middle class and the same groups the politicians need to move that public opinion. So let's talk about the political side of this. You see, both parties know healthcare panics gets votes, but the administration in power has the upper hand. And if the public feels healthcare is under attack, the White House can frame itself as the protector of healthcare, even if their own policy triggered the instability. So what looks like chaos could actually be a controlled burn. You see, a chaos that lets the administration say, look what happens when government isn't funded. See, we need more control, not less. And that's the key phrase, more control. So every crisis like this lays the groundwork for the next step, greater centralization. When premiums spike and people panic, the administration can push new solutions like digital IDs for quicker verification, government-managed healthcare accounts, or digital-first infrastructures to avoid disruptions during shutdowns. It sounds good on paper, right? No more shutdown delays, no more lost paperwork. But let's be real, every step forward towards digital efficiency also means more government oversight over your healthcare and your spending. It's a familiar pattern: crisis, fear, solution, control. Here's where it becomes a political gold mine. When people are scared, they want someone to save them. If the administration frames itself as the only one capable of restoring stability, boom, they've won the narrative. And not just politically, It also justifies bigger budgets, emergency powers, and expands digital systems that might otherwise face pushback. You see, that's why fear is such a powerful motivator. You can't see it, but it's shaping the laws being written behind closed doors. Because while we're worried about healthcare bills, they're drafting the next phase of digital governance. Think about it. Healthcare isn't just healthcare anymore, it's data. Is digital identity, and it is tied to how future welfare programs, digital dollars, and even universal basic income could work together. So when you hear your premiums are rising because of the shutdown, maybe ask, or is it the shutdown being used to justify the next evolution of the system? Because fear doesn't just control people, it prepares them to accept change. Whether you believe this is a strategy or coincidence, one thing is clear. Rising health costs during a shutdown don't just happen. They're part of a much bigger power game that keeps repeating. So ask yourself, is this about healthcare or is it about control? So drop your thoughts below, because this conversation here, it's one that they'd rather you didn't have. Stay curious, stay skeptical. If you like this breakdown, please leave a comment and consider subscribing for more updated content. Bye-bye.